Hello, my name is McKenzie. Excuse my appearance, I'm recently out of surgery. And because I was in surgery, I had to quit my hormones for over a month. So, what I'm going to do is show you how I do injections. But first, the different ways you can take hormones. There's pellets you can put on your skin. There are pills you can take. There are creams you can apply to your skin, or you can take injections. I've never done the pellets, so I can't speak on those. The pills I don't really like because you lose a lot of it in your digestive system, and you never really know what you're getting. Creams the same way, you never really know the amount you're getting. I do and prefer injections. So when you're forced to go off your hormones, it puts your body in a state of called induced menopause. It's really horrible. You get really moody, bitchy, emotional. Your skin dries out. You get very crabby. If you look up menopause, I get all of these. It's not fun. So, in order to get a diagnosis to get hormones, you have to be diagnosed with gender dysphoria. I never really thought about it, so I looked it up to see just exactly what this means. And what it is, a state of severe distress or unhappiness caused by a feeling that one's gender identity does not match one's sex as registered at birth. This is gender dysphoria. And my psychiatrist says I am a classic case. So, that being said, this little box I keep all my hormones in. This is progesterone, which I take in addition to my hormones. Progesterone works with estrogen. It keeps your heart strong, keeps your bones strong, and also helps you sleep really well. I take estrogen. I open up a fresh bottle. This one's never been used yet. I'm breaking my fingernails opening it. Okay, so we get set up. Syringe. Alcohol swab. This is a large draw needle. I draw the estrogen out of this bottle with this. And I'll take it off and I'll inject with a smaller needle because it's a lot more comfortable. So first thing I do, open up your alcohol swab. Keep all the sterile things like the syringes, needles covered until they're ready to be used. First thing, you wipe the top, kill any contaminants. Put this on top so it's not touching anything. Take my draw needle. You can inject with these, but it's like a big lawn dart. It's not comfortable. So you put the tip in, screw it on, take the top off. Carefully take the top off. Don't touch your fingers. Now, what you do, you draw this, move this back and forth a few times, loosens it up. I'm going to pull it back to a bit more than the amount of estrogen I want to inject. The reason I do this it makes it easier to draw. So I push the air in the bottle. I will draw it out. You have to do this a couple of times. Gotta get all the air to the top, and you're gonna do this back and forth a few times until you get all of the air out. Could use a little more light. A little more. Okay, where are we at? Almost ready. I do little pulses with my thumb because it seems to be the best way to get the air out. I'm gonna go 0.05 milliliters. I'm gonna draw just slightly more than that. And the reason being, I have to switch needles. So, cover my needle carefully. Twist it off. Now I take my injection needle. Don't touch the needle. Twist it on. Cap off. Carefully take the cover off. I have lotion on my hands. Hard to do. Okay, now I want to get the exact amount that I want. Tap it lightly with the thumb. You can see a little estrogen coming off the top. So I know I've got the air all out. Now, this is for intramuscular injection. So I just use the thigh. Thigh is big muscle and it's easy. So, just gonna put it in. This does not hurt. And slowly inject. But I don't take anything out yet. I'm gonna leave it sitting here for at least a good 10 seconds so it doesn't leak out. All right? And then quick out. No blood, no pain, doesn't hurt at all. Carefully cover my needle back up. God, I needed that. Okay, that's all there is to it. This is one injection I take 1 time a week. Your levels vary depending on what your body size, what you need. I take 0.05. Other people will vary. This is amazing for your skin. Redistributes body fat on your body. It will get rid of my menopause symptoms. And it does really remarkable things, basically rewiring your brain. If you take this for like 6 months or more, your brain will change significantly. How you think, how you react, how you feel about things, how you interact with people, it will all change. And it's really incredible. And I love it. And that's all I have for this. So, I'll say one last thing. The reason I do take injections, I know exactly how much I'm getting. It's quick and it's easy. Pills go through your liver, so it's taxing on your liver. This does not. It goes right into the bloodstream. For me, it's the best way. It might not be best for everybody, but this is best for me. So best to look up each method and see which works best for you. And that's it.